Over 18s can now get their COVID-19 vaccine, and they have been coming out in their numbers. However, it remains to be seen if the momentum will be sustained. South Africa's fight against the coronavirus is no longer hampered by an undersupply of vaccines, but rather by an under-demand. This is according to a report released by the Centre for Social Change at the University of Johannesburg in collaboration with the Human Sciences Research Council. The main reason people are reluctant to get vaccinated is the fear of possible side effects. To talk more about this and how we can overcome vaccine hesitancy is Dr. Daniel Israel from the Gauteng General Practitioners Collaboration. Dr. Israel, thank you very much for your time this morning. And I'm going to go out on a limb here, and I might be vilified for making this statement, but I'm quite tired of people making uninformed decisions. Anti-vaxxers are entirely fine by me if they've made a decision based on facts, but people making irrational decisions purely out of fear based on random WhatsApp groups spouting misinformation and what do they call it, conspiracy theories, that's not fine by me. And I think many people who've done the socially right thing by getting vaccinated, not just for themselves, but for their peers and for the safety of all of us, may feel the same way. So how do we get over that fear? How do we get through to people who are very scared, and maybe rightly so?
Thanks for having me, Annie. So I think that, interestingly, the strengths of the times of today is social media and the availability of information, and even if it's colloquial information. And the real strength of that is that at the beginning of COVID-19, we were able to enforce masks and sanitizing and distancing. But now, with that strength comes a very big weakness, and that's fear, and ambivalence spreads a lot through that type of media. And as you rightly say, they are not backed by scientific, robust data. And the interesting thing is, one would never ask, how does the ibuprofen I'm taking working? How does the paracetamol I'm taking work? But there's been such a fear created by this COVID-19 that, as you rightly say, this is palpable in society. So to address the question of how to get over it, I think we need to understand where it's coming from. So there are a small group of people in South Africa who are anti-vaxxers, who have a philosophy of not vaccinating, as much as we may disagree with them. But the majority of the people anxious and not doing vaccines in South Africa are not doing them purely because they feel that they're healthy and well now. Perhaps they don't see their own personal risk, and they're not prepared to go and put themselves out on a limb for something that is not a definite, in their minds, intervention. But this is absolutely wrong, and we need to educate, and we need to reassure people. And Annie, may I also add that, it's interesting to see how we've seen with various health programs in South Africa that sometimes just a pure little, push on the side, or a little, a goal on a simple level that someone can strive for can be very inspiring for them. And we've seen it with the corporates getting on board, Game, Wimpy, Discovery, and kind of incentivizing people to do vaccines. Perhaps that's
Dr. Israel, I agree with you there 100%. Incentivizing has its place, but ultimately we also need to get buy-in. And this new cohort between 18 years old to 34-year-olds, that's very important. Tell us why they are so crucial in terms of numbers of vaccinated.
So the 18 to 34-year-olds comprise a very big percentage of the population in South Africa. And we know that if we're looking for population or herd immunity in the long run, we need to vaccinate a large percentage. It's all about numbers. I keep telling patients, even if you feel as though you're not vaccine because of your own risk, you really think about the next person. Because at the end of the day, by getting these large numbers of young people to buy in, we can significantly drop infection rates in South Africa. That's why it's important. The good side is that 18 to 35-year-olds are often very up-to-date, social media aware, technological, able to be, go out there and actually get themselves to the vaccination sites. The downside is that they consider themselves low risk, and they think, if I got COVID, well, I'd be okay anyway. So we may have a problem there trying to get them through that mindset.